Okay, so hi everyone, welcome. Thank you very much for joining us today for this training session, which is for members of the public involved in or interested in being involved in research. So we're really excited about today's session, which is going to be focusing on what is the research process. The session is also an opportunity for us to launch our new Public Collaborator Training and Development booklet, which you'll hear more about later. And similar to the booklet, this has been a bit of a collaborative effort. So the webinar today is being led by the National Institute for Health and Care Research, or the NIHR, Applied Research Collaboration in Southwest Peninsula, fondly known as PenARC. And it's also got support from the NIHR School for Primary Care Research. So just to introduce myself, I'm Hallie. I'm the Public Involvement and Engagement Manager for the School for Primary Care Research. And I'm just going to be helping to chair and facilitate the session today. Before we begin, just a few little bits of housekeeping. You must hear this all the time with online meetings, but just to say, we're recording the session and we're making it available after the session. We'll be putting it on our YouTube channel, which means that you can catch up on any of the content, and it means that those who weren't able to make it can catch up as well. But if you prefer to keep your cameras off because of that's absolutely fine. We're also going to turn closed captions on for those that need it as well. I'll do that as soon as the session starts. I'll do it now. We're also going to share the slides after the session as well. So if there's anything, you don't have to frantically take notes or feel like you need to really focus on the slides because we'll share them afterwards as well. As always, we've got quite a large group, so I'd be really grateful if you could keep your microphones muted when you're not speaking, just to minimize background noise. There's going to be loads of time for questions, and our presenters are very happy to answer anything and everything that you might want to know about the research process. So I think I will now hand over to Beccy and Annette to introduce themselves and lead today's session.
Thank you. Yeah, so I'm Beccy. It's lovely to see you all here today. So I'm a research associate with with PenARC, like Hallie said, and this is Annette. If you want to.
Hello, I'm Annette and I'm a PPIE member in Exeter. Bit cloudy today, but pleased to be meeting you all.
Brilliant, thank you. And hopefully today's session will focus around answering the question, what is the research process? So hopefully by the end, you'll understand and identify the steps of the research process, and you'll be able to understand and describe some examples of how patient and public members can be involved throughout the research process. So you can think of the research process as a journey. So you take this journey so that you can find out something new. And today we're going to be thinking about what trail markers pop up along the research journey, so that we're going to look at some real world examples of patient and public involvement that can take place at the different points. But what we really want to stress is that please feel free to ask questions as we go along. Don't feel like you've got a question right at the start and you can't ask it till right at the end. Please kind of wave your hands or put your hand, raise your hand function so that I can see, or Annette can see, that we can answer your question as soon as possible. Okie dokie. So we start the research journey by thinking about what is it that we already know, and where do we have gaps in what we know. So the way that we tend to do this is we'll look at what research has already been done so we can see what's around. But importantly, the other thing that we do is we talk to people within the local community to see what needs that they have in terms of health or social care services, that they have those needs, but they're not actually currently being met. And by doing this two approach, we can actually pin down what it is that we need to research next. And I'm just going to hand over to Annette, who's going to share an example of one of the ways that she's spoken to researchers about the needs of the community through something that we call Ideas Cafes.
Hello. Well, We host ideas cafes where researchers come to us with sometimes the tiniest nugget of an idea, sometimes a bit further along in the research process, and ask us what we think and what direction they could go in. They know what they would like to find out towards the end, but they don't know how to get there and who to approach. Well, a group of PPIE members all get together with them and we discuss it. And sometimes we say things, people to approach. They want some more information of groups that we know of. Like I've worked doing a healthy parent carers workshop, and we said, "Oh, why don't you approach Devon Carers if you want to speak to somebody regarding that?" And they can outreach to all their members. And they come with us and they discuss it, and then they fine tune what they're going to ask during the research. And we can take a look over that and say, oh, no, it needs to be more plain English. You're talking in researchers' language. We're only members of the public, and that to us wouldn't make sense. And so they can do that. Nor we can help anywhere along the journey and give our advice and feedback, or if they're a bit unsure on something, they can come and discuss it with us and we'll give our feedback. What I enjoy about it is you never know what you're going to be discussing next. One time it's breast cancer, the next time it could be healthy parent carers. You never know what's coming up, and it's great. I like being put on the hop. They have started informing us what it's about, but I never click on that to read it because I like thinking straight away what I would. My first thought is usually what I think anyway. So that's how we try to help, by steering their questions, making sure they're relevant and understandable, and pointing them in the direction of groups that they may wish to contact to help their research. Healthy parent carers was started with a very nugget of an idea, and now it's gone national now, where people who are carers for other people, their health is noticeably not as good as people who don't care. And so we've worked together and developed this program which can be delivered to parent carers. And we had to sort of say, well, no, that's not right. Or you have to take into account that they may not be able to make that times of day, or you make it online or in person. And we were asked all our feedback, and it was really interesting. And it's so great to see that it's gone countrywide now.
That's great, thank you. So excitingly, we've also started to run some of these idea cafes like based in the community, so in person, so that we can widen the range of people that are involved in shaping the research that we do. And ideas cafes and these pop-up research cafes in the community are more kind of conversation-based ways of involving people at this stage. But there's lots of different ways that you can be involved. A lot of the work that I do centers around involving young people. So I tend to use like interactive games or music to involve people even in the early stages of research. So now that we're able to figure out what the gap in our knowledge is, our next stop along the research journey is being able to state what the research we will be doing is in one easy question. So if we think of an example of this, if we spoke to members of the public and they let us know that for farming communities, back pain is a real problem for people. We might then look out there, see what research has already been done, and we might see that actually there is a new treatment that's out there that looks promising, but it's not actually being used at the moment to manage people's back pain. So our research question might be, is our new treatment better at managing people's back pain than the current treatment that we use? So we've got our nice research question, and our next stop along the way is thinking about, okay, how do we actually answer that research question? So we can try and answer a research question using different approaches. So you might use an approach that relies more so on like numbers and statistics. So for example, if thinking about that back pain example, We might ask people to rate their pain on a scale of 1 to 5, like before they take a medication and after. Another way that you could look into your research question is you might use an approach that relies more on people's words and experiences. So, for example, we might ask people about their experiences of pain once they've been taking a pain medication for a period of time. Just to make things even more confusing, you can also take an approach that relies on numbers as well as words. So if we think about that example that we spoke about back pain, you might ask people to rate their pain before they have a medication and after, but you also might speak to them about what that experience has been like as well. So I'm just going to hand over to Annette, who's going to talk to you about an example of being involved in some PPI workshops to kind of plan how you're actually going to approach a project.
Hello, yes, I was involved in a project about treating people who are autistic at the dentist. And they were very keen to be able to treat people with dentists. Well, I have a son who is autistic, so I know, well, I'm aware of some problems at the dentist. And we were able to shape her research going forward by suggesting that it was a good idea to just go and have a visit at the dentist, no dental treatment or no examination whatsoever, and just to have a look at the lights and have a ride in the chair, ride up and down, just to get them used to going, seeing a friendly face, and they know what's going to be happening. And we were able to do that. So after that, we carried along with the research, and it ended up, because of some of the things that we said, they found that letting them choose a CD of their choice and headphones really helped. And another thing that we suggested to introduce was these, I don't know what they're called, but they're goggles that you watch a DVD on. And so they're interested in watching the DVD, the person with autism. And so they're not taking such a lot of notice of the work that's being done in their mouth. And it was really good to see that it was such a successful thing that it was taken further. So I was really pleased to hear that our input as members of the public was listened to and acted upon and tried out, not just taken for granted. They went and found a dentist who was willing to cooperate and let people have visits, and it was really successful. And she said, I am definitely going to do this, with anybody who requires it. So it was great to know that people were getting dental treatment with a lot less stress, not only for the person who has autism, but also for the families of the people taking them. So it was really great and useful to be able to, share our thoughts and views on that.
Great. Oh, I just saw a hand go up. Was there a question?
Yeah, thank you. Thank you, Annette. It goes to show where family carer involvement that knows the person can add value. Well, earlier on, at the first example that you gave, you talked about researchers coming to you and you may not know what the subject is, which doesn't abode with lived experience, because let's just say someone who's got a loved one with frontotemporal dementia, with motor neurone disease and primary progressive aphasia. As a group of PPI, it can't be that you're all things to all people. And that's where the researcher needs to advertise, looking at what some of the inclusion criteria may well be, so that there is a discussion where knowledge, lived experience comes into play. But it's great what you're doing with your conversation caps and all that. Very good, because normally, unless if a researcher wants to get started in research, you have to go to the Research Support Service to get £300 to get a PPI workshop. So if you're doing things differently down in the Peninsula, that's absolutely fantastic. Thank you.
You're welcome.
Yeah, it's a good point to bring up about making sure that people have relevant experience. So it's kind of like we were talking about, the cafes are one example. So we during the cafes, people are free to share if they have lived experience of a particular, for example, health condition, if that's relevant to the study. But also, we then do support researchers with holding these then maybe workshops that actually are with people that have lived experience of a specific thing, if they want to then take that involvement further. Like the cafes that Annette mentioned, they are kind of like those early stages. It's really encouraging people to start thinking about getting people involved at the early stages, just so that they can see how it doesn't have to be like a massive event that you spend lots of, you can sit down and really just talk to people about their lived experience. But yes, it's a very good point that you also need to be careful that you are involving people that have relevant lived experience to the work that you are doing as well. Thank you. Okie dokie. So our next stop on our research journey is going to actually be going out and collecting the information that we need to actually answer our research question. So if we think about an example of this, if we're using that numbers and statistics approach that we mentioned to answer our question, we might give one group of patients current medication that they're taking to treat back pain. We then might give another group of patients a new treatment. And throughout that entire time that they're taking the medication, we might ask them to rate their pain. And that the information or the data that we would be collecting is that pain rating from patients. Does that make sense to people? Are you happy? Perfect. Okay, so I'm going to hand over to Annette, who's going to give us an example of being involved at this stage of the research process.
Well, at this stage of the research process, this is where we come down very hard on the researchers, but in a friendly way. We say, oh no, you can't ask in that particular way because it just doesn't make sense. You have to be clear exactly what you want, and we help them develop plain English questions. Because it's very important that the average person understands exactly what is being asked of them. And all about, I've had people, researchers sort of saying, oh, qualitative and quantitative. And I said, I didn't go to university. I said, what does it mean in plain English, please? And I said, everybody needs to be able to understand this. So you need to word your questions appropriately and change if necessary. So they reword the questions and come back to us, and we say, yes, that's completely easy for everybody to understand, and it is clear what you are asking and what you would want of us, people to help you. So that's fine. And then other parts of the process, as I explained with autism in dentistry, we suggested, going first to try out and nothing to do with having your teeth checked. And things like that we can suggest, which is written into their research, which helps progress it forward.
Great, thank you. So that's one way that people can be involved at this stage, but another way that members of the public can also be involved is they can actually be the ones that go out there and collect the information, or they go and collect the data. So another project that I've worked on before, I worked with public members to kind of develop their skills in being able to interview people. And they actually went out and conducted the interviews with patients that were participating in the study. So they were collecting the data as a part, so like a peer researcher on the project. So we are now at the point in the research journey where we've happily collected all the information that we need, and I'm sure that that's always happens to time. And the next stop on the research journey will be sort of analysing that information or data that we collected. So what that means is that we're going to examine the information really carefully, and we're going to interpret meaning from it. So if we kind of think back to that pain management example that we looked at, and if we'd been collecting people's pain rating from groups of patients that received the current treatment for 12 months and the pain ratings from the group that had the new treatment for 12 months, by comparing the difference in people's pain between those two groups, we can actually interpret and figure out which medication is working better at managing people's pain. So that's how we find meaning from all the data or information that we've collected. So I'm just going to hand over to Annette, who's going to share her example of being involved at this stage.
My apologies about that. In the chat, Claudette said, it is good that language is simplified for more people to access the research journey. How much of that simplified language is then available in other languages or Braille? Are you able to answer that, Beccy?
So that's a very good question, and I think that tends to depend on the project itself. So there will be some materials available in sort of general involvement information from centrally, but usually it's quite specific to the project and what they have the funds to have available for people. There is, as you might already know, there is a big movement towards inclusive research now, and that being a requirement of having funds for projects. So they have to evidence how their approach to the research will be inclusive for different people's needs, and as a part of that would be having different translations for things, having materials for different accessibility needs. But yeah, it will depend on the project itself, exactly what is available to people. I hope that answers that okay. If not,
I
please
see
follow up with another
Francesco
question.
has his hand up.
Oh, yeah.
It's only to make a point that my mental health trust, where I am, Avon and Wiltshire Mental Health Trust, their website has got a software called Recite.me that enables all the Word documents, PDF. It's got browse aloud. You can increase the size of the fonts. The browser aloud will speak to the individual that have got hearing impairment. You can put on the caption. But basically, if you look at making reasonable adjustment for people that might have, hearing impairments, visual impairments, those who don't have English as a first language, it enables people to engage. Okay, admittedly, if you're on the internet. It doesn't answer all the question like what Annette was talking about Claudette, but I think given that the universities and the NHS trusts predominantly are the hosts that holds a contract for research, whatever applications goes in, given that the NIHR 2 Novembers ago talked about the importance of ensuring that people who don't have English as a first language make use of interpretation and translation so that nobody's left behind. The same could be said of the universities and others to make sure that their website is accessible in a way that maybe I'm not saying Avon and Wiltshire is the world leader, but I've tested it in my language of Italian, and it's got all the A to Z. So it wouldn't take that much. It wasn't so long ago when I first got involved that if you didn't speak English, you couldn't understand English or consent in English. This is only 2006. You didn't get involved in research. Researchers weren't trained about using. We've moved on with the Equality Act, so things have improved. That's brilliant. Thank you, Annette.
You're welcome.
Yeah, and hopefully things will continue that way and continue to improve. And, if there's really good practice out there, like from the website that you mentioned, there's nothing that stops us learning from that and ensuring that things that we do in the future are more inclusive for people. So thank you for bringing that in. Yeah, Annette.
It's good that Hallie has said, as a funder of research, the NIHR require researchers applying for funding to cost in the budget for research inclusion. So that's great. That includes things like costs for translation of documents throughout their research. So it's really good to know that things are definitely moving in the right direction from years ago, that's for sure.
Yeah, definitely. Thank you. Did you have anything else to add to this slide before we carried on?
No, we can carry on.
Okay.
There's just another hand.
Yep.
Oh,
Yeah.
sorry.
Did you want to come in?
I'm just a hand. Just interesting. I mean, I'm an EB at Exeter, and I noticed there's no control groups in your research. Could you explain that?
Yeah, so hopefully, if it was a proper official trial, that would be in there, if that was the approach that you were taking. So to be honest, I was trying to kind of keep it at more of a like an introductory kind of level, just to get a sense of what the process kind of is. Hopefully, when we hear a little bit more about the training booklet that we're going to launch later, there might be a course. It sounds like potentially that you're a bit more used to being involved in to a greater extent. So there might be some training there that might be a bit more on your level of experience, and also to push things a bit further. But yeah, so depending on the type of study that you are doing, especially usually if it's around medication, that there will be a control group. But yeah.
That's good. No, it just occurred to me, because everything I've done before has always been a control group, and which you would therefore judge your research, your results against the control group.
Yeah. So usually, so just to kind of make sure we're all up to speed, so a control group, what that would be is basically a group that kind of either doesn't have the medication at all or carries on with what routinely happens in practice. So if it was you were testing a new medication, you might have another group then that isn't receiving any medication, and you might have another group that's receiving the current treatment as well. So it's just a different term for it.
Lovely.
Right.
Thank you,
Thank
Beccy.
you. Okie dokie. Any more questions before I...
As a member of PPIE, thank you so much for explaining that so clearly, Beccy.
Well, I'm glad you thought it was clear. Okay, thank you. Right, moving on to the next one. So, the next stop on our journey is basically we found out our new piece of information, and we want to make sure that we share that with other people. So this can be done through lots of different routes, and you want to kind of decide which route that you're going to take to sharing information. It'll depend on who you're trying to share that information with. So if we'd found out our new medication is the best way possible to go, we might share with other academics what we found by writing an academic journal. But if we want to make sure that patients actually that have that condition find out the information, then we might work with a charity to kind of put it in their newsletter or on their website. Personally, I enjoy more creative ways of sharing the learning that comes from research. So that might be creating a game or writing a song or poetry. And you can do this in so many different ways. There's so many different possibilities. But I'm going to hand over to Annette, who's going to share about her sharing with other people about being involved in research and sharing that information with people.
Hello, yes. Well, one of the ways that I've been involved in sharing information is we've been to a conference at Buckfast, and we've held a stall there where we've got leaflets, and we can explain to people what we as PPI do and how we share results with things. We suggest where they can disseminate the results to. By the way, I didn't know what disseminate was when I first joined, where they can share the results to, such as the Healthy Parent Carers meeting. They wanted to do a trial of this training for healthy parent carers, and I suggested contacting Devon Carers, and where they can share the results to. There's online Facebook groups, and the Dentistry National Autistic Society, we shared it with them. Is how we can spread the word. We've also got little business cards that we're given as members of the PPIE group, saying to people, oh, we do this kind of work, and are you interested in it? Here's the website. Would you like any more information? Is there any questions that we can answer? It's all about getting the word out, spreading the word, and answering any queries or questions. because when I first joined and heard that it was being held at the university, I said, oh, I haven't got a university education. I said, I'm just a mum. And they said, oh, no, it's just because it's held at the university. And that was a barrier to me, because I thought that you had to, have a university education. But so I'm very quick to point that out to everyone that I speak to, that it's perfectly okay just to be an ordinary member of the public, but it's useful if you have lived experience or are a carer for somebody with lived experience with, different challenges or things like that, because then you can share your lived experience. So we go out of our way, set up stalls, go and visit groups. Beccy and I have been to visit Devon carers and explained that we would like people to join us to help with our research. And it's really just getting the word out there in any way we can. A lot of word of mouth, a lot of groups and conferences, and anyone who's got any interest, like on some groups that I belong to, I share with them, this is what we do, would you like to get involved? It's really great to be able to hopefully just give a nugget of information that might change a lot of things for a lot of people. And it's really good to be involved in research, and I'm always singing the praises of it.
That's great. So just to give an example as well of sharing like findings from a specific study, a project that I was involved in, the way that we shared back with families and children about the findings of the project was we had basically a family fun day that we put on, and we created different games, and each game for the children was related to one of the things that we found from the study. So, for example, one of the findings was that parents found it quite hard to know where to go to find out about financial support that was available to them. So we had like a little buried treasure game for the kids to get involved with, and then we spoke to the parents about their experiences and also shared back then what we had found as well. So it doesn't have to necessarily be like a written thing to share back what you found. You can, like Annette said, just go out there and speak to people about that. Okay. So that kind of wraps up the research journey as it stands. But the really interesting thing about the research process is that once you've kind of done all these steps that we walk through and you've shared back what you found, when you're having conversations around what you found with people and public members, that you can actually help figure out what it is that you're going to research next. So actually, the process turns into this continual loop, because every time you find something and talk to people about what you find that next thing that you can then research, and you carry on round again. So that was kind of just a short kind of main steps that are involved in the research process and walking through that. But are there any questions or anything that you would like me to go back to? I see Annette raising your hand.
In the chat, Karen has said, do you use the TVS SDE, Thames Valley and Surrey Secure on Data environment to access patient data?
I might have to see that written down. Sorry, 2 seconds. What was the secure? Oh, I see it. Sorry, thank you. So I don't know that individually myself, so I'm not as involved in as many like projects that use a lot of anonymized patient data. I know other projects I've been on have used other platforms to access like patient data, but I don't know that one specifically myself, but that could just be that I'm not involved in those projects specifically. Sorry, I couldn't be more help around that question.
A Zoom user has asked, is AI started to be included more? I can't say too much on this because I actually had to sign a confidentiality document before we took part in this research, but I can say definitely that it is being discussed and researched, but I'm unfortunately unable to say very much about that at the moment, so sorry about that.
So there are some projects that have started to involve AI in different ways, and also to look around people's experiences or kind of willingness around using that and how people feel about the use of that. So it's kind of there's that step of people actually looking into using it, but also how comfortable people are with that as well. So it's kind of a two-pronged thing that's happening at the moment, I think. Yeah, Francisco, was that another? Is that the palm
Yeah,
hand?
it's just to say it's quite interesting, isn't it? Annette's talking about. I'm involved with AI and CT scans because ultimately having medium contrast going into the body, it has an impact because it's isotope and it can affect people in terms of introducing cancer into the individual. So bringing AI instead, this is a European Union project, enables all the disposables not and not put people at risk. So there is more benefit potentially than there is risk as it currently stands at the moment. But a confidentiality agreement, a non-disclosure agreement, interesting, isn't it? It's just unfortunate, but I guess, it's the world that we live in, especially if it's commercial research. But there you go. You know what to say and when to say it and when not to say it. So well done on you. Yeah.
See, I'm glad Annette knows because I'd be terrible. Okie dokie. Any other questions from anyone? Okay. So we do have some time set aside for a quick break for a minute before we kind of go on to talking about the training booklet that's been put together. Shall we have about 10 minutes for the break? Does that sound all right with everybody? Perfecto. So I will see you back in 10 minutes. Before we kind of move on to the public collaborator training booklet that we're launching, I just wanted to double check that there weren't any last questions that came to mind during the break about the research process in general. Anything that's popped up in people's minds? I think I saw someone's hand go up then. Where is...
Yeah, Jay.
Perfect. Hi.
Hi. I was just wondering that some of the processes that you engage in, I picked up that you would actually be doing face-to-face engagements. Would there be online engagements as well?
So do you mean like would they be sort of at the same event online and in person or separate events
Well,
or?
perhaps it could be both, but I was just thinking about the cafe idea when you had discussion groups. Was that something that would be done online, or would that be sort of meeting at a particular venue?
So the ones that Annette spoke about has been involved with, as far as I'm aware, I believe your ones are online that you're a part of.
Yes, ours are online at the moment, but further down the research process, we do have in-person meetings and discussions.
Yeah. And we've now started doing some of those ideas cafes. We do them now in the community. So we host at like different community centres throughout Cornwall. And we try to link with communities that maybe wouldn't be able to engage with as much if we only hosted something online. So we're trying to do that mix now to reach people a bit more.
To have online and face-to-face at the same time?
So not so the cafes themselves, like we wouldn't do like the same cafe wouldn't be both online and in person. We hold some in person and people can come, or we hold some online if people prefer, and then they can come to those. Just to kind of
perhaps that could be something that could be moved towards, particularly if people have issues with mobility, to feel more included in the community if they were able to have both face-to-face and online available at the same time.
Yeah, no, it's a good point to consider, especially if it's, yeah, it kind of widens that scope of people to be able to be involved. Yeah.
Okay. Thank you.
Thanks. Pam, is that the hand I saw? Yeah.
Yeah, I did put my question in the chat, but I was wondering whether your booklet, I mean, I'm sure all will be revealed shortly, but will you be talking about the feasibility study? Because I was just recently on one, and it seemed to me as though you actually had to prove yourself before you even started, if that makes sense. So what is the expectation with a feasibility group?
Yep. That's a good, I was mid-type, but I will it'll be easier for me to speak about anyway, so thank you. Yeah, a feasibility study is a specific type of project that people have to do. So for example, if they did want to test a new medicine on with patients, they would kind of do a smaller study first to establish that yes, you would be able to do like a really large scale study that involved lots of different hospitals and a lot of patients. So that's a specific type of study that you, like you say, you almost have to prove that you could potentially do a bigger study on it and that it would be worth putting the funding into that. We didn't kind of mention specifically feasibility studies today, just because we wanted to keep it quite general so that it was more applicable to different types of projects. So, for example, in PenARC, where I'm based, we don't always do studies that involve like medications, for example. Like we might do things about the way services are delivered. So you might not necessarily do a feasibility study in that situation. So we've kept it kind of general for people today at this session, but potentially that's other sessions we could do in the future that we would encourage you to tell us about that you would like information around so that we could do sessions that gave a bit more in depth on what feasibility studies are, when to do them, why to do them, those kind of things.
Yeah, thank you.
Thanks.
Becky, in the chat, there's a question about if a member of the public wanted to approach researchers who may be interested in a research question suggested by that member of the public. Is there a platform for this?
So that is a very good question. So my answer is that there is kind of informal networks. So if I just talk about PenARC, because I know more about the way that they work. So we have members of our patient and public involvement team that they are always in the community. So they will go and always you never see them in the office. They're always out in connecting with different community groups, and they're not there to kind of sell people on getting involved in research that we're doing. They do talk to them about research that we are doing, but they also are there to listen, to hear what people need and what people think needs to happen in research next. So there's kind of those informal networks of members of staff being out and working around in the community. We also try to host events where we will purposefully go out and connect with different communities that are often not involved in research to try and understand what needs they have, and so that we can shape our future research around priorities that are important to them. So there's not a kind of a formal process that people can kind of click on that and submit an idea via a form or something. It's more about those partnerships and connections that we have with our community members. Any other questions at all? If not, then I might hand over to Hallie to talk us through the training booklet.
Thanks, Becky. I was just going to say in response to that last question as well, I was just about to type something in the chat, but you've given me the floor. So if it's okay, I might jump in. Just to say that often it can seem like researchers are hard to access, but if you have an idea for research and you know the kind of topic area it might be, whether it's heart health or cancer, just start talking to people about it. And we're pretty good at kind of linking people up to the right people in a way. So do just start having conversations with people, and you might find that you get to someone who is really willing to help you answer that research question in your community. There are also more formal platforms. So the NIHR has a website, I can put a link in the chat, where you can suggest an idea for research, but that's more, you're a member of the public, you've got an idea, and then you put it out there that that's something that our funders might want to consider. And it's less that you're kind of involved in that research process. But there's definitely a few different avenues from that. And I feel that's the direction that research is heading, where more and more the research idea is coming from the public or communities, and then we're trying to find researchers that can actually, that have the research skills that can help you answer those questions. So yeah, I hope that's helpful. Shall I, is there slides for this, Beccy? Shall we pull them up?
Yes, I can, yeah.
So yeah, now we have a captive audience. This session is, I guess, our first sort of live offering that's linked to our newly launched Public Collaborator Training and Development booklet. So this booklet brings together a range of different training and support opportunities, specifically for public collaborators in research. So members of the public who are wanting to get involved in research or may already be involved in it. And it's really around building confidence, knowledge, and skills for people in these roles. So we developed this largely in response to feedback from our public networks that it can sometimes be really hard to find training that's specific for the public, or when you do find a training, it's hard to know whether it's for people who are completely new to involvement, or maybe for people who are more experienced and have been doing this for a lot longer. And the hope with this booklet is really that we can overcome some of those challenges. So it's been a collaborative effort across the public involvement leads working with the School for Primary Care Research. And so we're really pleased to be able to finally share it. So the booklet is organized into 3 training areas. So one on research methods. So once we have the recording of this session, for example, we'll put that in the research methods section. We've also got 2 further sections on interpersonal skills and public collaborator roles. And it brings together existing training. So that's things like recorded webinars, helpful booklets, and online courses around lots of different topics under those headings. So at the moment, we've just only released the research methods section, and we're hoping to launch the interpersonal skills and the public collaborator roles section soon. And within those 3 sections, there's 3 levels of learning. And this is really in response to that feedback that it's hard to know what's more of an entry level training and what's more kind of advanced skills once you've been doing a role for a little bit longer. So the explore section is more of this introductory materials for those who are really new to public involvement. Then you've got your grow, which is opportunities to kind of deepen those skills and support more active involvement. And then there's the support level, which is the more, it's more about kind of peer learning and reflective opportunities for those who are experienced public collaborators. So it's a freely available resource. I'll pop a link in the chat to it. We're going to continually update it with new opportunities. So do check back on the page periodically to see what's been added. And equally, it's kind of an open resource. So we're very happy for others to let us know if there's anything that's missing, and we can add it in. And we'd be very happy for you to share this with others as well. So yeah, that's the training and collaborator booklet. So I hope you find it useful. And if you have any feedback about it as well, we'd be really grateful. And I'm happy to answer any questions about it as well. Just popping the link in the chat.
Oh, I think there's a question from Jackie, is it? Oh, I think you might still be on mute.
I get that. I was just going to ask, are you going to send a copy when you do the updates? Are you going to send it to all the people that's attended today?
Yes, I definitely could send I could send a link to the page with the slides and the recording if that would be helpful.
Yeah, and when you update it, will we get the updates?
So no, sorry, I'm just going to mute myself for a second. Sorry, I'm in a public space, so there's a large group of people walking past that I didn't want any background noise. So we won't explicitly kind of send it out once we have the updates, but once you have the link, we'd kind of encourage you to go and check on it every now and then, because we'll kind of be updating it regularly. We will do some comms when we launch the next two section, so the interpersonal skills and the public collaborator role. So we'll share that quite widely.
All right. Thank you, Ali.
Nice question, please.
Yes.
Yeah.
Sorry.
Yeah.
Yes, go ahead.
Yeah, I'm just looking at that slide that you're showing. And the most important part I can see, very important, is where it comes from. But the interaction with the public is share your ideas and get in touch. The font size for that element, I think, ought to be bigger.
Yes, that's fair. It's shrunk down on the slides. I promise you it is a bit bigger in the booklet format. But yes, that's very true. We should bring that to people's attention. Thank you. Frank?
You.
Oh, you're just on mute.
Would this be equally applicable? Could it, ultimately the School of Social Care or Public Health, the various ARCs, the research delivery network, could it be adapted to fit their configurations?
Yeah, absolutely. It's not specific to primary care at all. It just so happens that a team from the primary care public involvement leads have put it together, but actually it's all very general in terms of health research. So we will be sharing it with the other schools, with the other NIHR teams, to get it out as wide as possible, because we're very happy for people to adapt it, to use it in their inductions for their public partners, and yeah, to just get it out there. Because I think what was missing was that the public training that was available was spread all over the place, and it was just really hard to find it. And so this kind of just brings everything together, that we're aware of, but there could be more out there as well that we're missing.
Yeah, that's brilliant. I've not looked inside the booklet, but I will. But does it have any links to NIHR Learn where people can pick up on good clinical practice, update, renew, and other various bits around, EDI and other learning beyond the booklet?
Yeah, so there's definitely training on there for in regards to equality, diversity, inclusion from memory. What we did was that we only put in training that had specifically been created for a public audience. So that might mean that the more things that you were just talking about, like the good clinical practice, which often the training you'll see for that is targeted more at researchers, although I understand that some members of the public might want to do that for additional kind of development. We wouldn't have included it in that just because it's not specifically for the public. But I like the idea about linking to Learning for Involvement and other platforms that we're aware of that could have even more learning opportunities if they're not finding what they're looking for in this booklet. I think that's a good idea.
Can I just throw in, and you're probably aware of it, Ali, anyway, is that in terms of being an equal member of the team, whether it's with a trial management committee or, when once people go beyond, PPI advisory group and get invited to become co-applicants and that, the NIHR, they go out of their way to say that each member, to include a public contributor, are equal members, within that group. In lots of ways, I've still yet to see that. in some ways, because there are issues around, how people are actually involved. I put a comment in, I've learned the hard way of accepting what was put in front of me. Now, when I'm asked to become a co-applicant, I make it quite clear what my expectations are. But that's come, I could have done with this training years ago. But hey, better late than never. So that's fantastic. Thank you.
Yeah, and it's funny you raise the challenge of public co-applicants. So we've got the third section we hope to launch is around public collaborator roles. So that's recognizing the different roles you might find yourself in the research kind of landscape. So whether, you get involved as a public reviewer, so reading applications and deciding whether they get funded. You might sit on an advisory board, as you said, or a steering group. As you kind of get more experience, you might find yourself sitting in a governance role, so a more strategic role, sitting on an organization's board. And the other thing, as you mentioned, Frank, is public co-applicant, which is where you're part of the research team, an equal member of the research team. And actually, we are hoping to launch something alongside that part of the booklet, which is a sneak preview of our plans ahead, a public co-applicant kind of support network, because we do recognize that people in public co-applicant roles, it varies widely in how you kind of get integrated as part of the team, whether that even does feel equal to you. And so we do want to create a bit of a kind of peer support group for people who've been public co-applicants, just to learn from each other and think about how we support people in those roles particularly better. So yeah, coming soon.
It sounds wonderful. Bring it on.
Yeah.
Thank you.
And yeah, we'll share that very widely once that's kind of released as well. Nice to see some thumbs up there. Just seeing if there's anything else in the chat or if there's any other questions. And I guess the other thing to put forward to you all as well is, I know we've heard a few already, but do you have ideas for training that you've currently not been able to find, but would be something that would really support you in your roles in research? So if you do have any ideas, do feel free to email kind of Beccy or myself, or put it in the chat now, in terms of areas that you think are currently a training gap and we've heard about feasibility trials, we've heard about public co-applicants and lots of other things today, and it's great making notes of all of those things. So we're very open to hearing ideas about training where it currently doesn't exist. Great. I think we've hit the end of questions, unless there's anything else or anything else that anyone wanted to say which I've missed in the chat. No. So Beccy, Beccy and Annette.
I think I just saw.
Jackie.
Sorry. I just wanted to say I think this has been really informative, this group today, and I've learned a lot more. Even though I thought I wouldn't learn anything really, I've learned a lot more.
Oh, I'm glad to hear it. Thank you so much for joining. Beccy, were you going to jump back in then, or were you just...
No, I was just going to say thank you for everyone for coming and for being so engaged with your questions as well. I really appreciate it. So thank you.
Yeah, no, thank you very much to everyone, and for Beccy and Annette for putting together it was a very accessible and easy to understand presentation as well. So in terms of the next steps, we will share the recording and the slides from the session. I will share a link to the Public Collaborator Training booklet. You might not get this immediately. I'd give it a week or two for the recording and the slides to come through, just so you're aware. And then do let us know if you have any ideas for training. As we said, we hope to kind of continue to do more live sessions like this as well on different topics that we don't think there's currently a good resource or training link to. So just a big thank you to Beccy and Annette as well for putting this together. And yeah, thank you all for your time, and we'll be in touch following up via email shortly.
Thank you and goodbye. Lovely to meet everybody.
Yeah, lovely to see you. Thank you so much for joining.
Yes.